safe 6 months. In my clinic, 3 months is okay. But that's from a literature that I have read. So for girls, we have dry season, we have greasy, oily season, and we have glowing season. It's because of our menstrual cycle. So we've mentioned that menstruation, 3 to 7 days prior to menstruation, we have this excessive sebum production and acne breakouts. What's this pregnenolone still? I just saw this last week in the Korean Derma Convention. This is more of the stress and acne. The stress pathway, which is the pathway that synthesizes more of the cortisol. So when you're always under stress, so that pathway, the pathway here, the pregnenolone to progesterone to cortisol, will be the one that's gonna predominate. And less of the DHEA, testosterone, and estrogen pathway. So this explains also your stress aggravating your acne problem. So tell our patients not to be stressed, but they also answer you, Doc, sino bang hindi nai-stress? Okay. So this is the explanation for that stress inducing acne. So hormonal treatments, we usually prescribe this to our female patients. And you already know the etiology, the excess androgen production. So the estrogens and anti-androgens counteract. We've mentioned this, they're anti-androgens. So we prescribe this far more for our female patients because we don't want to feminize our male patients. We don't want them to have gynecomastia and other feminine features. So the estrogens have been proven to reduce the size of the sebaceous glands and also reduce sebum production. So your oral pills, contraceptive pills, we can prescribe them in our female patients. And it's almost never prescribed. But I mentioned I have a male acne patient who wants to be feminized, so I gave the pills. Okay. But there are some of female patients, they don't respond, right, to the pills. On the other hand, it worsened their acne. Like in my case, if I take pills, acne is worse, okay? So it may work for some of our female patients, but not for the others, okay? So in terms of the anti-androgens or the androgen receptor blocker, we have your spironolactone, okay? You can, if you have patients with resistant acne or not responding to any of the treatment standard regimen, you can also prescribe spironolactone. You can start with a 50 milligram per day or increase to the max dose 200 milligram per day. So this is the one I've mentioned about, there's these 2 studies found that combination clindamycin and benzoyl peroxide gel may be more effective in females than males. So more of our girls are responder than the male patients. And another study found that dapsone, I don't use dapsone in my clinic, but it mentioned that it worked better in females. The good thing, a final study mentioned that oral isotret showed no difference in efficacy between male and females. So our standard treatment for severe acne, the isotretinoin, is effective for both genders. So we have to really classify the degree of severity as well as the type of the lesion so we can have our series of treatments. Your topical acne, we give them to our mild cases. And this is a non-inflammatory acne under treatment of a topical retinoids or even topical antibiotic. And this has inflammatory papules on the chin and neck, so you can treat them with topical retinoids and topical antibiotics. Systemic acne treatment, you have your oral antibiotics, okay, hormonal therapy we've mentioned, your androgen receptor blockers, and your oral isotret. So hormonal therapy, mentioned a while ago already, your pills, spironolactone, you can have glutamide and finasteride. There's a literature saying it can work for female patients, but it's not really licensed, or we're not licensed to prescribe this for female patients. So your oral isotret, severe acne patient, treated with isotret, so noted clearance of the acne lesions. And for male, the males are more of the one who tend to get the acne scarring because they tend to have the more severe acne condition. So this one you can combine with your surgical excision and drainage, especially the male patient. So that's the isotrep and mode of action. Nowadays, we can do the combination treatment. So you have your standard topicals, your orals. Now we can combine your energy-based devices. Okay? And also our chemical pills for acne management for both males and females. Okay. So, non-ablative, we have your light lasers, low-level light therapy, our LED, radio frequency, it's non-ablative, it coagulates the sebaceous glands. So there's, like last week, they have a topic on acne treatment using energy-based devices alone. So they have presented clinical success rates for that. In your minimally ablative, you have your chem pills, you have your microdermabrasions, diamond pill, hydropil, photodynamic therapy. And there was also a lecturer saying that you can treat acne via dermal remodeling, making use of these ablative lasers. So aggressive, right? Because in my practice, I don't even recommend like CO2 fractional laser when there is active acne. So the mechanism of action of this light therapy is that they kill the Cutibacterium acne. They are also anti-inflammatory and they can disrupt the sebaceous gland function. So we have a photochemical, photothermal, photoimmunologic. So this is again non-ablative acne treatment. The good thing with this, as mentioned last week, they can reduce bacterial resistance. So if you use lasers, if we wanted to reduce resistance, okay, these are good alternatives. I don't say, for me, in my practice, this is not my main line for acne management. It's just more of combination. I can combine with my energy-based devices. So this is IPL, okay? We have IPL that's also for acne treatment or your light therapy, PDT, infrared, also the ones with combination of a chemical like aminolevulinic or your methylaminolevulinate. This is He-Light. I have this in my clinic. I use the yellow light, anti-inflammatory, or the blue light, the anti-Cutibacterium acne. So this is low-level light therapy. So I mentioned about the ablative laser. So we have last week Korean doctors mentioning dermal remodeling via ablating the skin. So aggressive. So this is my RF microneedling under electronics. I also use this for my patients with acne scarring, but at the same time, even if they have active acne, I can still use this RF microneedling. I had one case I'll show you later on with the hormonal therapy plus this. Then there was improvement. Or lasers. We can now have, some companies will tell you this laser is also anti-acne. Oxylite, what else? Even the lucid NDIAG toning for acne, we also have that. Then this is KTP, potassium titanyl phosphate laser. It was presented last week. It's also for anti-acne. Because I see some patients coming to my clinic, they were from like out of the country. Then they will say like in Saudi, they have this laser, they will just burn my acne. So you're thinking of a laser device that they're using in the Middle East. So surgical management, you already know that. Okay. So these are considerations when we manage our both male and female patients. Okay. Just want to mention a little bit of some new drugs that they're developing right now. The sarecycline. It's like limecycline. It's already approved in United States. Allergan is the one that made this one. Some topical minocycline foam under phase 3 clinical trial. There are these agents that they're studying right now to reduce the sebum production. They have the SB204. It's a nitric oxide releasing agent targeting the inflammation and the C. acne. It's in phase 3 clinical trial. Or the olumacostat. It's a molecule that's targeting the acetyl-CoA carboxylase, which is a key enzyme in sebum production in phase 2 clinical trial. Or texolone, so also in phase 3 clinical trial. That's an anti-androgen. So, time's up na ba? Few minutes na lang. So just a little bit, I had a severe acne patient. Most of the cases of severe acne I get are from male patients. So I treated him on oral isotretinoin definitely. He's an evangelical worker, so he has to look good. His skin must be clear from this cystic nodular acne. And in terms of my maintenance, I use the Acnorm line. I think this morning it was lectured because I like those lines. They have botanically derived products. They're good alternatives for those standard regimens, especially if our patients are reacting to this standard therapy. This is the female client I had on RF microneedling. Even with this moderate acne lesions, so hormonal therapy only, intralesional injections, RF microneedling, great improvement. So I think a combination of those standard regimen with our current energy-based devices will be a best approach for both males and females. But of course, you have to take into consideration the differences in the male and female skin. And what will be your therapeutic approach? You have to be precise in your history, in your physical exam, and then be able to give the best therapeutic approach for your patient. With that, I say, thank you. 감사합니다. Oh yeah, thanks, Doctora. I have an open invitation for our PAPSHPI members. We have invited a Korean doctor. He's the president of the KCCS. He will be coming over. He will lecture tomorrow morning. And he's welcoming us to have a demo on thread lifting. So it's going to be free. We can do it in our clinic. And those who are available this Friday, like 9 a.m., there will be a demonstration on use of PTO threads. It could be face lifting, nose lifting, brow lifting, under eye threads, neck threads. Okay, so this Friday, those who are available, please approach me. Thank you very much, Dr. Grace, for reminding me. Okay.
Thank you, Dr. Contessa Alapag, for that comprehensive lecture. Are there any questions from the floor? Okay, so we now proceed for the